Hi, I'm Dr. VanBuskirk. I'm the Medical Director for Home Hospice of Grayson, Cooke, and Fannin counties. I feel blessed to have the role of a full-time medical director. My role as a medical director is really twofold. First, to meet Medicare requirements, certifying that patients are eligible for hospice care, and then later certifying that they are eligible for continued hospice care. The second arm of my job is to supervise the medical aspects of a patient's care, reviewing their medicines and their problems and making sure that they are medically appropriately addressed. I'm also the medical director for our palliative care program. Palliative care is care that focuses on symptom management and the relief of suffering. The goal of palliative care is to improve the quality of life of patients no matter where they are in the course of their illness. Hospice care focuses primarily on end-of-life care. Palliative care can be received at any point in the course of one's illness. Typically, it begins at the time of a diagnosis of a chronic illness, and the goals are, as I mentioned, to relieve suffering and improve the quality of life. So, everybody who is in hospice care receives palliative care, but you can receive palliative care without being eligible or without enrolling in hospice care. When I see a patient, a typical visit involves talking with them, asking what symptoms they have that disturb them most, how those symptoms interfere with them enjoying their life, how those symptoms affect their activities of daily living, how those symptoms affect the quality of their life. Sometimes those questions are answered by patients, but many times they're answered by caregivers. I use those answers to certify the patient's eligibility for hospice care. Medicare requirements are that after the first 6 months that I make a recertification visit every 2 months, and that I use the information gathered in that visit as part of my recertification of the patient for continued care. I also use those visits to adjust the patient's medications or other support that they might be receiving to improve the quality of their life.